Good evening, Commissioners, Chairman, Mr. Manager. Thank you for giving us the opportunity to come talk to you tonight. We started the Race Cars project, which is the randomized cluster evaluation cardiac arrest systems, back July 1st, 2022. So we've been able to compile 3 years worth of data to show you, and that's what we want to show tonight, is where we've made our improvements, where we've changed things based off of more hands-only CPR teaching, more community involvement, being able to change our entire cardiac arrest approach to how we approach those patients that are in cardiac arrest. With me tonight, I have Dr. Chris Granger, who's a cardiologist at Duke University. He is one of the clinical trial leaders for this, and I'm going to allow him to present the data for you guys.
Great, thank you, Scott, and thanks for the chance to be here. And yeah, I'm a cardiologist at Duke. I used to work over down the street at Franklin Regional Medical Center doing shifts when I was a cardiology fellow a long time ago. Pretty familiar with your community, have a number of patients here, and really appreciate the work that you all do. And let me start by calling out Scott and saying that I've worked with EMS agencies all around the country, and Scott Parrish and the group here is really terrific. They're doing a remarkable job, and I really appreciate that on behalf of all your community members here in Franklin County. So cardiac arrest it's a common cause of death. There's about 8,000 or 9,000 people in North Carolina who die each year from cardiac arrest. Maybe 1 out of 10 people who die, that's what they die. That's how they die. And unfortunately, when someone's heart stops beating effectively and they become unresponsive outside of the hospital, only about less than 1 in 10 survive. And it could be much better than that. And we know what improves survival, and it's the cardiac arrest being witnessed, bystander CPR, the person there knowing how to do CPR, starting CPR, calling 911, and then first responders getting there. And I'll get back to the first responders because that's so important. Paramedics get there, but it's important to have something done before the paramedics get there. Ideally, having an AED placed, an automatic external defibrillator placed, and having the rhythm shocked to save someone before EMS gets there. Because you only have about 10 minutes before the brain has irreversible injury from lack of blood supply. And it takes, Scott, about 10 minutes for paramedics to get there. So that's why it's still really important they get there. Critically important to save the lives, but something has to happen before then, and that's the community knowing CPR, the members of the community knowing CPR, calling 911. The telecommunicators in the 911 dispatch center, also really important that they recognize that it's a cardiac arrest, and they instruct the person to do CPR. And even someone who maybe just had a little bit of training many years ago, with the telecommunicator doing a good job instructing CPR, pretty good CPR can be done that can save the person's life. And then finally, the first responders. Now, first responders in North Carolina, usually it's fire, and in rural communities, a lot of times it's volunteer firemen. And that's something I think there may be an opportunity in Franklin County to have even more engagement with fire in this process. Law enforcement, the sheriff's department, especially in the rural environment, can also really help. Okay, so that's a little bit of background. Now I'll go through this pretty quickly. So this is a trial that's supported by the federal government, by the National Institutes of Health. We took 60 counties in North Carolina and randomized them to either intervention. Intervention means we do the best we can at those 3 things: training everybody CPR, having the telecommunicators identify that it's a cardiac arrest and instruct CPR, and having first responders get there with an AED. Those 3 things in intervention counties. And then we have control counties. They're doing what they normally do. And what we want to show is that if we do like what Scott Parrish and his team are doing in Franklin County, in our intervention counties, we can improve survival compared to the control counties. And it'll really change. I think it'll change, if we're successful, it'll change what's done around the country. So not only will it help residents of Franklin County, it'll help people all around the country. These are the intervention counties in red, and you see Franklin County and Person County and Warren County are are kind of a cluster here of counties that are in the intervention group. Covers about 80% of the population of North Carolina, this trial. In Franklin County, since the beginnings, over this 3 years, there's been 120 cardiac arrests, and I think 7 of them have survived, something like that, which is about what we expect. But what we want to see is that improving. Unfortunately, most cardiac arrests occur in people's homes. If they occurred downtown in a supermarket where there are a lot of people around, then we could save a lot more people. But if it occurs in people's homes, then we have to train each person CPR and to call 911 and to get to that home quickly. And that's hard. So here's the good news. And this is just a chart that shows these 30 intervention counties. And on the left-hand side of this chart are the smaller counties, and then on the right-hand side, the larger counties. For the small, medium-sized counties, Franklin County is the best in North Carolina at bystander CPR. And that's, again, due to the work that Scott has done on training people CPR. I think we can do even better, but it's really good. The bad news, and this is true of every rural county, is it's a lot harder to get first responders there and put an AED on. And that's because distances are longer. There's less resources for having AEDs in every fireman's car, of having law enforcement have AEDs. But those are some of the things that Scott's working on doing, getting more AEDs in the hands of people who will save the lives of these people when they arrive at the cardiac arrest. And then this is the defibrillation rates are low. But there's opportunity, and there's I think there has been some important improvement over time. Survival with good neurologic outcome, it's relatively low. In rural counties, it's only 3 or 4%, and that's about what it's been in Franklin County. But again, every one of those people is someone who goes home to their families and has another Christmas celebration, and so it's really important, and I think we can improve that. The telecommunicators are doing a really good job. They're as good as anybody in the state at recognizing when someone calls and it's a cardiac arrest, which can be hard to do from the telecommunicators. And then they're also pretty good at instructing the person to do CPR and getting that done fairly quickly, because the quicker that's done, the more likely there is for survival. This is that relationship that I was talking about, that you have about 10 minutes, and for every minute of delay during that 10 minutes, there's about a 10% lower chance of survival. So if we can get that first responder there within 5 to 7 minutes, well, there's a really good chance for survival. And that's why the fire departments and the law enforcement is so important to this project. And that was shown, these are data that were published from North Carolina showing that if it's in these first 5 minutes or so, when the AED was placed, it was most often by the first responders and not very commonly by the paramedics, because it takes them longer to get there. So we talk about this chain of survival. It starts with recognizing that it's a cardiac arrest, calling 911, doing CPR, and using the AED. And we did this interesting analysis. We said, okay, if it's so important to have the firemen get there quickly, is there a relationship between how far your house is from the nearest fire department and survival? And there was. If you live near, it's kind of like insurance rates and go up if you're further from a fire department for home insurance. Same thing here. You're more likely to survive if you live near a fire department that's staffed with someone who can respond if there's a cardiac arrest call. So again, our 3 interventions are bystander CPR. By the way, Scott, this is something for you all to know. And this is so great because this is really a community effort, and you all are the community leaders. So I'm so glad you're interested to have us update this. But on February 25th, we're going to try to break the world record on number of people trained in CPR in one day. And so, and Scott will be working on this in Franklin County. We'll try to get a bunch of people trained on February 25th. Then the 911 dispatch center, they're doing a good job here. And the first responders, like every rural county, there's opportunity for more AEDs in the hands of firemen who will go right to these cardiac arrests. So I'll summarize then with just these few points. Survival is mainly determined by two things: bystander CPR and defibrillation that occurs pretty quickly. The care of cardiac arrest, the way survival is improved is through community efforts. It's through the people, leaders in this room knowing about this and supporting it. The public, telecommunicators, and first responders all play a key role in that link of survival. They all need to play their part. Community leaders, health systems are critical to organize the community. And then data collection. This is another thing Scott and his team does, is data collection, because we collect information on every cardiac arrest so we know how long did it take, what are the areas for improvement, how can we improve. That's another important part of this. So thanks again for hearing our update, and thank you to your community for your commitment to this important project to save more lives.
Thank you. Very good. Thank you.
And just to add a few things from Dr. Granger's presentation is we were one of the first recipients of the Heart Safe Workplace. Franklin County as a whole was in the state. We made a commitment to train 100% of our employees in hands-only CPR. We've added that into new employee orientation when they come through. Our safety team does that through departments as well, so we are still continuing that piece. We've trained, we had a goal of 10% of the population of the county, so roughly a little over 7,000 people. We're sitting right around 4,500 to 5,000 people that we've trained in the communities and through our workplace as well as a whole in hands-on CPR. So adding more CPR to the community, giving more recognition. Our telecommunicators do a great job of being able to recognize this on the phone and telling people, you know, when to start CPR, which is a tough job in and of itself because you're sitting on a phone trying to figure out if someone needs, you know, CPR. Of course, the old joke is if they tell you to stop, they probably don't need it, right? Which is what we teach as well. So we are pushing out more public access AEDs. We've donated several to churches, which is something we're trying to do and put more into community and more in lock boxes or AED cabinets, not necessarily locked, outside for community involvement so they can get an AED whenever they dial 911. Any questions?
Any questions from the board?
I've got